Bert, a lot has been said and written about your health over the last couple of years. You've had a few scares. Can you tell me about that?
John, I enjoyed the best of health for most of my life, but God obviously kept all the bad news until I reached near my 70s. And a couple of years ago, I had an attack of pneumonia. And then last year, I decided to do a quadruple bypass. They mentioned a double first up, then they said a triple, and I'm still lying there. They came back and told me it was a quadruple, and I think my answer to them was, if you make it 5, I'm getting out of here. But it really did, and particularly with this important week that we're celebrating, it brought home to me, number one, the importance of your health, number two, the importance of looking after your health, and number three, just how the world of medicine has evolved and changed.
It sounds to me like you're very active in management of your own health, and that you are, in fact, medicine-wise.
I think the important thing is with medicine, as I discovered, you need to know what you're taking. You need to know the active ingredient. And the other important thing I learnt was it's important that you remember that there's a use-by date. Now, some people will go to their medication after a use-by date, but wouldn't dream to do that with a can of soup.
No.
And a can of soup is not nearly as important as that medicine you're taking.
But that's why medicine's list is so important. Do you have a list?
I do. Yes, I do.
And what's on it, and how do you go about it?
Well, actually, I had a list even before the surgery last year. Post the operation, I kept it on me just in case, anything happened. Perhaps I was being too dramatic.
Share it with everybody.
Well, yeah, if anyone asks, well, this is what I want. No, but just in case you required medical treatment with someone who was a stranger to you,
absolutely.
I had the list there.
Now, you mentioned that you've got a medicine cabinet. Now, be honest with me, Bert. When was the last time you cleared it out?
You may have to ring Patty regarding that. She is officer in charge of the medicine cabinet, and I don't mind that being the case, and she does a great job, but occasionally...
She also reads your medicine list to know what should be in the medicine cabinet.
She does.
But do you clean it out, Bert?
It's important to be honest, yes, she cleans it out. But she's very good at the job, and if anyone is interested in hiring someone to clean out their medicine chest, she's quite reasonable.
Now, instructions for medicines, they can be very complex. How do you follow your instructions, and what rules and routines do you have to help you to do that?
Well, first rule is the list. The second rule is that you check regularly. You don't have to do it every day, but check as regularly as you feel that you need to when that medication should be taken. And it's important that you ask questions.
What sort of questions are at the top of your mind if you're talking, say to your doctor or pharmacist?
Prior to the operation with my GP, I explained the symptoms that I had. And I've got a feeling that even before he did a full examination, and then the specialist did a full examination.
They knew.
He knew what path it was. Any symptom that you feel that has not been there before, it's worthwhile addressing, and ask the questions of the doctor, because it could be the symptom that you've got and you believe is caused by A, it could be caused by B.
Yes, indeed.
And the medication for that would
I was
be
just
totally
going to
different.
say, what about the medications? Obviously, you're looking to see if there's any side effects or allergy. Or...
Important, yeah. And you'll get the help there from your medical man or woman, because that's what they're trained for. I think also a definite no-no always is self-medication. If something has worked for you and you haven't been attention-wise looking at that little bottle that and gives you a use-by date, even if you haven't been required to take it for a couple of weeks or a couple of months or whatever, even if the use-by date is current, don't self-medicate. Go to the doctor, because this time around there might be something more important.
Thank you, Bert. So good to talk with you. This NPS Medicine Wise Week.
Thank you, John, and great seeing you, and also terrific to be part of a most important week, and I hope the message gets out to everyone, but particularly people round about what age.
You mean our age?
That's it.